You've been taking your autoimmune medications exactly as prescribed, maybe for months, maybe for years or decades. And at first they helped. Your symptoms calmed down, your flares weren't as intense, but over time they stopped working or you had to keep increasing the dosage. And here's what nobody told you. Those medications aren't healing your body. They're teaching your immune system to stay overactive and your nervous system to stay on guard. And it also disconnects you from your body's natural ability to heal. So if you have a paper cut, do you have to tell your skin to heal? No, because it does it on its own. When we take medications chronically, it interferes with your body's healing capabilities. I'm Nancy Ma, physical therapist and autoimmune freedom coach. And today I'm going to show you why suppressing your immune system keeps you stuck in survival mode and what your body actually needs to feel safe enough to heal on its own without medications. Because the women who finally break free from chronic inflammation, they're not the ones who found better medications. They're the ones who learned how to work with your body's intelligence instead of against it. So let me start by showing you what's really happening when you take autoimmune medications. First, your immune system works a lot like a seesaw. On one side, you have cell-mediated immunity. This is the part of your immune system that fights viruses, bacteria, and even cancer. And on the other side, you have something called antibody-mediated immunity, which builds antibodies to protect you from infections. And when you're healthy, that seesaw stays balanced. But with autoimmune disease, that balance starts to tip. The antibody side rises too high and your body starts building antibodies against itself, your joints, your thyroid, your gut, your tissues. And that's what autoimmune disease really is. Your immune system has lost its balance. Now, here's what most doctors do when they see this. They want to help you feel better, which is why you go to them. So they prescribe medications, biologics, immunosuppressants, and steroids. And these drugs suppress your immune system. They push the whole seesaw down on both sides. And yes, this often reduces symptoms. And yes, this can be a good thing at first to get the pain and inflammation down so you can cope because the inflammation drops, flares calm down. But here's the problem. You don't need this as a long-term solution, and you don't need your whole entire immune system to be suppressed. You actually need it more balanced. And when medications suppress the entire immune system, they don't just reduce the part attacking you, they also suppress the part that protects you from infections and cancer. And that's why those medication commercials list side effects like tuberculosis, serious infections, increased cancer disease. Because when your immune system is suppressed, your body can't defend itself properly. This is why this is not a long-term solution. It's not a forever solution. I can't say this enough. And here's another layer that most people never hear about. When your immune system is suppressed, your nervous system never gets the signal that it's safe. Your body still braces, still scans for danger, and still waits for the next threat. That's what your immune system does. So even though symptoms are quieter from an external source, i.e. the medication, your body never actually learns how to heal because your immune system also is the one that turns on the safety switch when it feels safe. It just learns how to stay dependent on external control like medications. And that's not healing, that's symptom management. And of course, there is a time and place for that, but that cannot be a forever solution. And management usually means being on medications for the rest of your life, unless you address the real imbalance underneath. And unless you're okay with that. And some people are totally okay with being on medications for their entire lives. And absolutely, there's no judgment, and that's completely okay. And this message is really for the woman who is tired of feeling numb, tired of her symptoms feeling worse, tired of chasing symptom management, and wants to have more control of her own body. Now, let's talk about your nervous system for a moment. Your nervous system has two main modes. The first is sympathetic, which is your fight or flight response. And the second is parasympathetic, which is your rest, digest, and heal state. Now, you can't be in both states at once. You're an either or. So when someone develops autoimmune symptoms, their nervous system has usually been stuck in that sympathetic drive for years. Their body just has been on high alert, scanning for danger, protecting them from a threat it can't quite identify. And that chronic activation creates inflammation, fatigue, pain, and brain fog. Your body is spending all of its energy on defense, and there's nothing left for healing, for recovery. Now, here's where medications come in. When you take drugs that suppress your immune system, your body doesn't interpret that as safety. It interprets it as control from the outside in. Your nervous system doesn't learn how to regulate itself. This is a skill that is absolutely 100% required to develop, because if you don't learn this skill, you will always be stuck relying on diets and pills and protocols to save you. And if you don't learn the skill, your nervous system stays activated while the medication forces the symptoms down. And they do work, and they are powerful in the short term at first. But over time, this creates a deeper issue. Your body starts to forget how to self-regulate. It forgets how to recognize safety. Just like muscles that aren't used will atrophy. If you stop, doing bicep curls, your biceps will get weak. And it's the same thing when it comes to regulating your nervous system. It forgets how to turn inflammation off naturally. So when people try to stop the medication suddenly, their bodies panic. Symptoms flare up, pain returns, and fatigue crashes back in because their system never learned how to operate without external suppression. And this is why I'm making it clear that this is not what I am suggesting you do. Never get off your medications cold turkey, and certainly not without medical supervision. And this is why so many women say things like, I'm better than I used to be, but I still don't feel like myself when they're on meds. That's because suppression isn't restoration. Your body isn't healing. At best, it's just being held down or paused. Let's pause here for a second. If you're watching this and realizing that your inflammation might not just be about your diet or your medications, and that it's actually coming from your nervous system being stuck in survival mode, I want to help you clarity on what's really going on. This is why I created a free tool called the Inflammation Indicator Test. It only takes a few minutes and it helps you uncover the real roots of your flare-ups, the things your medications can't touch. You'll get your results instantly, plus a personalized plan based on your score. The link is in the description below. Let's talk about the real root causes that your medications can't touch. So if medications aren't healing you, what is? And after 20 years of working with women with autoimmune conditions and chronic pain, I've seen something very consistent. Your body doesn't randomly decide to attack itself. Something pushed your immune system out of balance, even before medications. And most of the time, that something is a combination of chronic stress, unresolved trauma, suppressed emotions, poor lifestyle habits, and a nervous system that never feels safe enough to rest. And when your body lives in chronic stress, whether from childhood experiences, relationships, work pressure, or constantly holding everything together, your system stays in survival mode. Your cortisol stays elevated and your inflammation stays high. Your immune system becomes confused. And over time, this builds what scientists call allostatic load. Think of it like a stress bucket. And when that bucket overflows, your body begins to break down. And that's when autoimmune symptoms appear. Your body isn't broken. It has simply been protecting you for so long that it doesn't know how to stop. And here's the key insight. Your body can't heal in a state of threat. It doesn't matter how clean your diet is or how many supplements or pills you're on or how perfectly you follow a protocol. If your nervous system doesn't feel safe, your immune system will stay regulated. And this is why some people do everything right and still flare up. Your body isn't resting, it's guarding. And until your nervous system learns that it's safe to let go, your immune system will keep reacting. Now, this leads us to how to safely transition off of medications. Now, again, full disclaimer is that I am not providing medical advice here. I am here to support you in advocating for yourself so that you can have more empowered conversations with your medical care provider. Now, I know what many of you are thinking right now. Okay, Nancy, this makes sense, but what if I try to stop my medications and everything gets worse? And that concern is 100% valid. I've seen many women try to quit medications suddenly and their bodies revolted. Their flare-ups return, their pain strikes again, and exhaustion comes crashing back. So let me be very clear. This is not about quitting medications overnight. This is about building a foundation strong enough that your body eventually doesn't need them anymore. So the first step is to work with your doctor or medical care provider. Never stop medications without medical supervision. Your doctor needs to be part of the process. And the truth is, not all doctors are very supportive of the process, and some can be. They do exist, and sometimes I know it can feel like they're hard to find, but I promise you they do exist. And this is why it's important for you to be be educated so you can advocate for yourself. Because if your doctor isn't open to that conversation, there are alternative options like functional medicine doctors, integrative physicians, holistic practitioners, and naturopaths who specialize in helping patients taper medications safely. And the second step is building your foundation before tapering. That means spending at least 30 to 90 days supporting your body. That's calming your nervous system, improving sleep, reducing stress, cleaning up your nutrition, and teaching your body how to feel safe again. You don't begin tapering until your body is stable and has a solid foundation. If your inflammation is already going down because you started modifying your lifestyle and you've implemented some of these tools to regulate your nervous system, then you can have that conversation. Remember, this isn't a race. This is about recalibration. Then, after building a foundation of safety in your body, only then you can start having the conversation with your doctor about tapering. This is where timing matters. So the third step is where you taper slowly, and you definitely do it with supervision with your doctor. So depending on the medication, this process can take months, not weeks. You gradually reduce the dose and observe how your body responds. If symptoms return, you pause. Give your system time to adjust. During this process, you're also supporting your body with the foundations that help it regulate again, like we talked about before. Nervous system regulation, breath work, vagal toning, eating a whole foods diet where you have all the micronutrients, movement, hydration, and having real rest. So you're simply not just removing medication. You're helping your body relearn how to do the job the medication was doing. And here's something important I've noticed after working with hundreds of women. The women who successfully reduce medications and stay off them are not superhuman. They're not lucky. They simply create the conditions where healing becomes possible. They prioritize their nervous system, they address the root causes driving their symptoms, and they give their bodies time and safety so their bodies can respond accordingly. Now, this is where self-advocacy becomes important. After about 60 to 90 days of lifestyle and nervous system changes, you can go back to your doctor and say, hey, I've made these adjustments over the past few months and I'm feeling better in these areas. Would it make sense to repeat labs and see if we can start tapering anything safely? And doctors generally respond well when you show measurable changes and a thoughtful plan. But to have this conversation, it helps to understand why medications are prescribed in the first place. Most medications fall into a few broad categories. Number one, life-saving medications. These are medications that protect vital organ function or prevent serious complications. So examples might include insulin for type 1 diabetes or certain heart medications and medications preventing organ rejection. These are not usually medications that you would ever stop abruptly. These decisions absolutely have to be made carefully with medical supervision. Second kind of medication would be disease-modifying medications. These medications attempt to slow the progression of a disease. So for autoimmune conditions, you have methotrexate, biologic medications, immune-modulating drugs. Whether these can be reduced depends on symptoms, lab results, and disease stability, and again, must be managed carefully by your doctor. Next category, symptom management medications. This is where you can have a little bit more say. These medications help control symptoms, but don't necessarily change the underlying disease. Examples include anti-inflammatories, muscle relaxants, certain pain medications, sleep medications, and hormone replacements some of the time. As the body begins regulating better, many people can gradually reduce reliance on these. And sometimes symptoms increase briefly during tapering, but with the right support, the body can often recalibrate. Now, for the hormone replacement medications, sometimes they're absolutely necessary. Like my parents had both their thyroids removed, so they definitely need to stay on their hormone replacement medications. But for some cases, they are optional to manage symptoms. Now, this is why it's important to work with your doctor so you can understand why certain medications are prescribed, and you must understand the side effects and the interactions with all the other drugs that you're taking so you can make an informed choice, so you can speak up for yourself. And then there's the over-the-counter medications or your as-needed medications that often include Tylenol or NSAIDs that you can take as needed. Now, you generally don't need to talk to your doctor about, but I would recommend that you still do so you have a good plan and accountability to help you manage your medications. So again, after all this, I still encourage you to always be informed and speak to your healthcare provider. So that way you're both monitoring your symptoms so you can know when they improve, and you'll know which ones are the easiest medications to taper off of or to stop altogether, because the body simply might not need them anymore. So I get that one of the challenges today is that so many people are seeing multiple specialists, like your psychiatrist, your rheumatologist, your endocrinologist, your family doctor, and these doctors often don't communicate closely with each other. So part of your role becomes understanding what each medication is for, what side effects it has, how your medications may interact with each other, which ones are helping with one thing but might be causing other symptoms, and whether the original reason for the prescription still exists. And this process takes time, but when you combine medical supervision with self-advocacy and real lifestyle changes, then many people are able to gradually reduce medications or get off them completely while improving their health and vitality. Because the body does have an incredible ability to regulate and recover when the right conditions are created. So here's where you're at right now. You understand that medications aren't healing you, they're just managing your symptoms. You understand that your nervous system has been stuck in survival mode, and you understand that real healing requires addressing the root cause, not just suppressing inflammation. But knowing this and actually doing it are two very different things. So if you're sitting here thinking, okay, Nancy, I understand this, but I don't know where to start. I don't know how to calm my nervous system. I don't know how to safely come off medications, and I don't know how to advocate for myself. You're not alone, and I do want to help. This is why I've opened up a few spots for a free energy activation call with my team. This is not an information session, and it is not medical advice. This is a strategy session. We're going to look at what your body has been holding on to, why your current approach hasn't worked, and we'll map out a personalized plan to help you and your nervous system finally feel safe enough to heal. So this call is only for women who are fully committed to healing, not just managing symptoms. So if that's you, the link is in the description below. Book your free call and let's figure out exactly what your body needs right now to break free from chronic inflammation for good. And if this video helped you see your body in a new way, make sure to like and subscribe, because the women who heal are the ones who finally realize their body was never the enemy. It's been the protector all along. So I see you, I appreciate you, and I'll see you in the next video.